Okay, good evening, everyone. So welcome to the Northwest Mental Health event. My name is Chris Webb. I'm the Head of Communications at the CWU. Really privileged to be able to join you and host this session tonight. We've got a fantastic panel, but most importantly, we've got lots of you who are going to want to ask questions. For those viewing on Zoom, we've also got Rosie Phillips, who's our signer. So if you seek out Rosie, you can pin her to the page. You'll also put that in the chat box, and you can take advantage of Rosie's fantastic signing. She does a great job for us on these sessions. We've currently got 134 people coming in, so that's fantastic. Introducing the panel then, we've got our Deputy Leader of the Labour Party and a great friend of the Union, Angela Rayner. Welcome, Angela. We've also got Shelley Asquith, who's a Health and Safety Officer at the TUC, someone, again, who's a friend of the Union, who's doing a fantastic job during this pandemic. I think anyone who thought safety was boring is having to rethink that right at this moment in time, that's for sure, in the Union movement. We've also got Steve Flatt, who is a psychotherapist. Steve also runs, is a director of Working Conversations, and it was a real privilege to have you here with us, Steve. We're looking forward to your contribution today. And last but by no means least, we've got our very own Jamie McGovern. Jamie is a safety rep. He's also a mental health first aid trainer and does a great job for the Northwest region. So Jamie, welcome to you as well. We're going to do a little bit of an introduction from the panel, and then we've got lots of questions and we want as much interaction as possible. If you want to put any questions you've got in the chat box, fire away and we'll try and pick them up. Before we do that, on a more somber note, we're using this session, this moment now, to reflect on those we have lost, both through COVID, but also mental health reasons, and those who are no longer with us. So I won't ask you to stand and recreate some of the awkwardness we're seeing on Zoom, but if you could just for a minute, bow your heads for a minute silence at this point, that'll be fantastic. Thank you, everyone. Okay, thank you, everyone. That's fantastic. So a nice poignant moment there to start the session with. We've got 154 people on with us, so that's brilliant. We've got many more watching on the Facebook channel. We're now going to give our brilliant panelists a chance to just introduce himself for a couple of minutes or so, starting with the Deputy Leader of the Labour Party, Angela Rayner.
Thank you, Chris, and it's fantastic to have so many people on this call, and for CWU to hold this event, and for Emma for organising it. So thank you to everyone who's aware. I don't think we should just have a mental health awareness week. I think if anything, these last couple of weeks have shown us with this pandemic that mental health awareness is something we should be aware of at all times. And I'm going to start off by being a bit honest with you. I found this really difficult these last few weeks, this lockdown, even though I'm in the privileged position of being able to move around more than people who are not considered essential workers. I've escaped some of it. I found it really difficult. And I'm someone who always thought that because of my working class upbringing in the North, that we weren't very tactile and we're not very touchy-feely in the North. And as a family, we don't tell each other we love each other, and cuddles are out like that, me and our kid. But I found this really difficult, this lockdown, and there isn't going to be a quick fix to this either. So I'm really pleased we're having this event, because the Labour Party, as well as our trade union movement, are going to have to look out for each other. We're going to have to do things in a different way than we've ever done it before. We're going to lose people and we're going to suffer bereavements. And we're not going to be able to grieve in the way that we've done that in the past. And our nation is going through something that in our lifetime, we've never gone through anything like this before. So I'm really pleased we're having this call. And I think one of the things that I'd like to come out of events like this is that we're all a little bit more honest about our mental health and when we're happy, but also about when we're sad and how we can reach out and support each other whilst we go through this. So I'm really pleased to be here. I've always looked after my mum from being a young person, and my mum's had bipolar, and I was a Samaritan, and I was a care worker, and I'm currently doing a bereavement service. I'm currently doing a befriending service for people with life-limiting conditions as well during this pandemic, because it's something that's close to my heart, is to support people. So I wanted to reach out to you to say, I'm finding it difficult, the situation that we're in at the moment. And I think if we can all look out for each other and be honest with each other about that and support each other, and hopefully at the end of this Zoom will give you some practical ways in which we can do that as well. And I just wanted to share that with you and tell you that I love you all dearly, and I love our big, happy, somewhat strange at times movement that we're part of. It makes me feel much more open to people around me at times when we're isolated a lot. So thank you.
Thank you, Angela. We love you too. I'm sure I'll speak for everyone now. Next up is Shelley, who's going to say a few words on behalf of the TUC.
Yeah, hi Chris, hi everyone. As Chris said at the start, my name's Shelley. I'm the TUC Health, Safety and Wellbeing Officer, and I actually only started the role 3 months ago, and in that time obviously we've all been experiencing a public and a workplace health and safety crisis, so it's been a bit of a baptism of fire. Now, just from my perspective, while of course I think it's important that we come together for these awareness days and awareness weeks, I think the emphasis really has to be moving away from awareness and towards taking action. Action to provide support to our members in the workplace, but also action to properly fund the mental health services that so many people need to rely on. Because that's the difference really when it comes to bosses, employers and unions. We're in the position to organise, not just kind of put up a poster and say, oh, we've done a bit of awareness raising now, but we need to organise and take action and get the action that our members need. I'll leave it there because I know some of that's going to come out in the conversations, but thanks very much for having me.
Thank you, Shelley. Over to Steve now. Steve, you want to introduce yourself, my friend?
Yeah. Hi, my name's Steve Flatt. I'd just like to say I feel really privileged to be on here today. It's an amazing opportunity to try and get some ideas and some connections and some networking, and hopefully to encourage people as well. As Chris said, I'm the Director of Working Conversations, also known as the Psychological Therapies Unit in Liverpool. One of the things that we did when we realised that this process was going to go on for some time was we set up a free service that's called Let's Keep Talking. It's a non-medical service. It's a simple phone service. It's a free phone number. And the object of the exercise was to give those people who are isolated, who are struggling maybe with physical conditions, who are shielding, an opportunity to talk with somebody outside of their family. And we have a whole bunch of therapists and volunteers who are there not to therapy you. Then we're not here to tell you what to do, but we're here to have a conversation and to try and discover what might be useful for anybody who wants to ring us up. And we have a structured process within the phone calls. And so far, we've had some remarkable successes with people who didn't think that there was any way of having a sensible conversation with other people outside of their own loneliness. So we offered that on the basis that that was the best thing to do. We're very much at what we call a social constructionist approach. We're not a medical organisation at all. And we take into consideration all the social aspects, because I personally sit on a committee related to political psychology, because that's my particular interest, because I believe that mental health is profoundly political. There is no aspect of human activity that is not touched by our mental well-being in some form. Without mental health, there is nothing. Without mental health, there is no physical health. Never mind parity of esteem. Mental health, you can be mentally well and physically disabled, but you can't be physically well and mentally disabled. So it's really important to remember that the priority lies with our well-being psychologically, not with our well-being physically. And so environment becomes fundamental, whether it's a workplace environment, whether it's a social environment, a home environment. All of those things are incredibly important and underpin our mental well-being. So there is no aspect of human activity that doesn't in some way underpin our mental health. And that's really the position that we come from. And the other thing I'd like to say is that I believe that every human being has a value of one. There are no people who are more valuable or less valuable. We all have a value of one. Thank you.
Thank you, Steve. Great words. And now over, last but not least, as I said to Jamie, Jamie's done some brilliant work on behalf of the union. And just to introduce yourself, my friend.
Yeah, I know a lot of people on this Zoom meeting will know me, Chris, but for those that don't, I've been a safety rep for this union for 25 years. I'm also an area health and safety rep, a mental health first aider, mental health ambassador, and now I'm proud to be a mental health first aid tutor. Of all of that, though, the thing that is most rewarding for me when, as a mental health first aider, when people are confident to approach you and ask for your support, because the thing that I've noticed over the last few years supporting people through their mental health journey is, you know, often people who are dealing with mental health issues make fantastic employees when they're given the support that they need. You know, they do make really fantastic employees. And just to touch on something Angela said there about, you know, every week is an awareness week. Certainly in the CWU over the last 2 years, every week has been a mental health awareness week for us, because, you know, we can't stop moving forward. So, yeah, but yeah, good to be on this call, and I hope it's a good debate tonight.
Thank you, Jamie. So I've been given a strict remit from Emma, who's given me a list of questions. So this is highly unusual for me being told what to do, but I'll make sure I stick to it. Emma's, so the first question is to Steve, who says, we've got a member who asked us, Steve, the current crisis seems to have had a massive implications for mental health, as you clearly outlined. What is the most important thing, in your view, we can do to look after our own mental health, and how do we do best to help those around us who are maybe struggling? That's to you, Steve.
Wow, just a small question.
Easy one to get you started, my friend.
Yeah, we have an expression that we use, which is called zooming in and zooming out. And the thing is that mental health, you can look at it under the microscope as the individual person and looking after your own individual mental health. Or you can put it in you can put it in the context of the environment. But that environment is so wide ranging. So I've written down dozens of different things that we could be doing. And from an individual point of view, we need to think about, first of all, maintaining a routine, maintaining some kind of activity, maintaining good health, maintaining good communications with as many people as we can. Some of the obvious things that I made, I've had a number of people who, because we're working quite hard with a lot of people at the moment, and some of the feedback I get is that couples are sometimes finding it difficult because they used to be going out and being sociable and all the rest of it. And I've suggested to people that they try making up date nights and reversing the roles, so that somebody who does the cooking normally gets cooked for, or people talk about not being able to go on holiday, so they do virtual travel on the computer and things like this if they have them. But the main thing from an individual point of view is that we need to maintain hope and the knowledge that we will get through this, and we can learn an awful lot about ourselves in this situation if we're given the opportunity to do so. And it's really important to recognize that we've got a very narrow window of opportunity here to make some huge changes that will benefit all people on this planet, not just in small number of individuals, or not particular economies, or not particular ways of working. We really need to use this to think about what it is to be a human being, and how we're going to be in the future, how we're going to treat each other. Are we going to be compassionate, or are we going to be cruel? The irony of it is that a lot of people have talked about, and some psychiatrists have talked about this being a pandemic of mental illness. In actual fact, disasters produce exactly the reverse. People come together, they support each other, they work together, they find ways of creating resources between themselves. The idea that the common person, the population, if you like, falls to pieces and becomes some kind of savage, selfish process is completely untrue. And the evidence is overwhelming. There are over 700 studies of disasters that show just how people pull together. And we need to be very careful not to start getting the messages that we are going to fall to pieces, because it just isn't true. The evidence isn't there. And I'd really like people to look after their own mental health, but more importantly, act socially and think about those around them. Think about what they can do for others, even in the smallest possible ways, because that interaction, that is the way that we will show our humanity and maintain our own mental health.
Thank you, Steve. That's fantastic. So I want to come now, if I can, first of all to Angela, then maybe to Shelley. Angela, obviously picking up from your former role as Shadow Education Secretary, there's a lot of pressure that we're seeing as a union on our teachers and also parents over the demand from the government to return to school from some students on the 1st of June. Obviously, as a union, we fully support the NEU and our other trade unions in the education sector and in their demands for 5 tests, and what they've set out we see as eminently sensible, and the union totally backs them. But that's putting a huge amount of stress on our teachers, on parents. What would your view be of that from the party, Angela? And then maybe Shelley, talk a little bit about what the TUC's involvement in this process.
Hey, yeah, thanks for that. And, you know, the government was too slow on going into lockdown. I think it's clear. I think the clear evidence is there that the government was failed to act quickly enough. And my concern now is they're failing to act quickly enough with the preparation before they're trying to lift the lockdown conditions, and that's the problem. Schools never closed, by the way. This is this myth that schools were shut or that teachers aren't doing their job and that teaching support staff aren't. They're all out there doing the job, and schools are open, and teaching staff and the auxiliary staff in schools have died through COVID as well. So you cannot underestimate the concerns that people have. And I'm a trade unionist, so the union members will have my full support. And Boris Johnson has done more for the trade union movement in the last couple of weeks than anyone in a lifetime, in the fact that he's frightened a whole group of workers who felt that they didn't need a trade union, who have realised that they were given 12 hours notice to go back into hazardous situations without any support and guidance. And the trade union movement have done a huge amount of work to try and work with the government. People don't often see that. They think the trade unions don't really like Tories, and I don't suppose they particularly like Tories, but they've certainly done their utmost, and I know your union has as well, in working with the government to try and support our frontline services to get us in a position where people can return to as much as normality as they possibly can, but in order to do it in a safe way. And the government have failed to act in a reasonable manner, I think, on this. And I really urge them to do that. Our children from the most disadvantaged backgrounds are suffering the most at the moment. The government are failing to give them the support. But teachers have been going out of their way to contact pupils, and the schools were left on their own. You know, they were left without the support they needed. And I want to put on record my thanks to those workers on the front line that have been continuing to do that. And we'll be making sure we push hard to make sure the government does what's right. And safety's got to be at the heart of that, you know. And we've already seen thousands of lives lost, unaccounted deaths in care homes because the government's mishandling. So I think the unions are absolutely right to ask those pertinent questions on how they're going to keep people safe before they cram our schools back full again. Anyone who's tried to put 4- and 5-year-olds into a classroom and keep social distancing knows it's just absolutely. I mean, I can't even do it in my own house with 10- and 11-year-olds, so there's no chance you can do that in a classroom setting. And I think the unions are absolutely right to raise those concerns.
Thank you, Angela. Shelley?
Yeah, I don't think schools and teachers have been given the time and resources to deal with any of this just yet. And the fact that they're being asked to take in many more children in little over a week's time, given the circumstances that we're in, is totally wrong. And as well, the demonisation from the media and even from some in the labour movement is an absolute disgrace, and the education unions deserve our complete solidarity in the face of that. As far as the TUC goes, we've been clear that it's not safe to end the lockdown for education workers or for anyone. You know, people that have been going to work this whole time have not been doing so in safe conditions, and it's not safe for more people to be going out just yet. And we'll back any action that the education unions choose to take in resisting being forced into danger.
Thank you, Shelley. That's fantastic. We've also got a message from Scott, who says, as a regional officer for the NEU, thanks for your support and backing. Now more than ever, the trade union needs to back each other 100%. I think that's spot on, Scott. And I mean, a message directly from our GS, Dave Ward, is that we've got all of your backs and always will have. So moving on then, question-wise, I'm going to go to Jamie if I can, and then maybe if Steve wants to come off the back of this. Jamie, the CWU, as you know, have trained hundreds of reps in mental health. How do you think we best utilise them, though, and what can our reps do to help those who are suffering and to improve mental well-being in all of our workplaces? So over to you, Jamie, if I can, and then maybe off the back of that.
Okay, I think coronavirus has really exemplified how important the mental health first aiders are in a time of crisis. Certainly in our area in the Northwest, they've been a godsend over the last 10 weeks. And for me, it's probably important that we accept that mental health first aiders are now here to stay. I know there's probably a wider societal debate on that. However, in the Northwest, mental health first aiders, they're part of our DNA as a union, really. I think we need to decide how we best use them. For example, in our area, lots of mental health first aiders are now competent in doing stress risk assessments, and that's been a key area for us over the last 10 weeks. When stress risk assessments are done properly with the right people, they really work for the individual, and I think the fact that we've got those mental health first aiders out there doing that now has been a massive benefit. I think we've also got to remember, though, that mental health first aiders, there's not too much expectancy on them. They're not there as an excuse or to justify a duty of care failure. We've got to make sure we use them for the right reasons. And as I said, they've been doing fantastic work in our area. One key area for me, though, is I think we need to get more young workers trained up on mental health first aid to ensure the balance is right in terms of peer-to-peer support that's out there. That's something we were trying to do in the Northwest region, but unfortunately, because of COVID-19, we've had to sort of shelve our training plans. But I do think getting young workers trained up over the next months and years is going to be really important in mental health first aid.
Thank you, Jamie. Steve, did you want to come in on that one?
Yeah, I agree completely with what Jamie's just saying. And I think one of the things I would say is that mental health first aid is the first step. It's the most important thing. When somebody actually admits that they're struggling or they're apparent, they're noticed because they're struggling, and somebody goes and talks to them, that recognition and that acceptance of that person without stigma, without any kind of judgment or anything like that, gives an opportunity for a conversation that can often de-escalate hugely the distress that somebody feels. But it also gives an opportunity, if it's required, for a signposting, but it shouldn't be an automatic signposting, because it may be that person can cope with just that support from that person in a community, somebody that they know. And the big problem that we have, and again, because we're not, there are people that I'm a registered nurse, and I have other colleagues who are clinical psychologists and things like that, but we try to avoid that kind of a role, because that in itself, once people start labeling, automatically kind of creates a kind of stigma. And what we're trying to do is to avoid that and accept that people are who they are, and they're struggling in their situations, and that almost invariably their distress is context based. And it's about understanding that if we're really going to make a difference, we have to start looking at creating security in the workplace, security of income, security of a sense of future. And if there's one thing that this COVID-19, this pandemic, has brought out, is that the myth of certainty that has been fed for so many years, that is actually never been there, but we've had to kind of accept and work with, despite the fact that the vast majority of the population has probably been quite insecure. And now we're really beginning to see that insecurity appear, and we need to be addressing that, not trying to go back to the old normal.
Thank you, Steve. I'm going to come to Shelley now and pick a couple of questions out of our chat, if I may. First one to you, Shelley, maybe to Angela to come on the back of, is our area safety rep from the North London is saying the fear factor from our members is increasing due to the inconsistent messages from the government. I mean, an example of that, obviously, an obvious one would be when Boris Johnson addressed the nations a couple of Sundays ago and basically told people to get back to work the next day, and there was like mass panic and and lots of fear and anxiety created by that move. I mean, someone who I think Dave Ward, our GS, is really praising and saying he's had a fantastic record during this period is Francis O'Grady, and the TUC were really on top of that the next day, and the government backpedaled on that. But that mixed messaging is making it really hard for people. Shelley, what would your view on that be?
Yeah, I completely appreciate how difficult it is and how a lot of people are confused. And I think that the government has got a lot to answer for in the way that it's managed this, particularly in the last few weeks in terms of the easing of the lockdown. I mean, what we've been pushing for, and there's a lot of things we asked the government for in terms of its back to work safety plan that it didn't adopt, but we continue to push for risk assessments to be mandatory, but not just that, to be published. And there's been a couple of employers that have done it already off the back of union pressure, publishing it on their website, making sure that bosses are accountable for the measures that they're introducing. But in terms of government messaging, I think what we need is similar to the stay at home slogan, although it's obviously now stay alert, whatever that means, but similar to what we saw with billboards and bus stops, kind of encouraging people to stay at home. We now need that to be saying what your rights are, as a worker, what you need to do if there's a breach in terms of health and safety in your workplace, who you contact, what the regulators are. These are the kind of things that is going to give confidence to people, and these are the kind of things that are going to protect people's health and safety, not a reckless plan that's not considered the science, not considered what measures bosses are going to take, and kind of relaxing it and thinking that bosses are just going to do the right thing. We know full well as trade unionists that bosses can't be relied on to do the right thing. They have to be forced to, and if the government's not going to force them, then it's got to be us.
Thanks, Shelley. I mean, Angela, one of the things that we've noticed since there's been a partial return to the House of Commons is how all over the place the Prime Minister is now. Keir is opposite him, and being able to question him and being able to set out the Labour Party's agenda. I mean, how important is it we continue to, even in a time of national crisis, hold the government to account on these issues?
I think it's really important, and I've been looking at the questions in the chat, and Andy, I wanted to just say, I saw your contribution as well, and I'm really sorry that happened. But I think that anxiety and the anxiety around potentially putting loved ones at risk, a lot of people are actually more concerned about looking after other people than they are about their own safety. And some people obviously are concerned, quite rightly, about their own safety as well. And one of the things Keir's tried to do is be a constructive opposition, because we want the government to succeed. There's not a single one of us in the Labour Party that want the government to fail on this, because every failure will cost lives and will put people at risk. So it's a different kind of opposition. And some people have found that really difficult because they want us to really go at the government. But actually, one of the things that we've been desperately trying to do is to get the government to push them to do more. So the testing, tracing and isolating is crucial. We know if we want to lift the restrictions on lockdown, we have to have a testing regime in place and a tracking regime, and we haven't had that. And if we're not tracking where the virus is, we can't keep the R rate down and we can't keep people safe. And, so we're really pushing the government on that, and obviously making sure that workers have the correct PPE and the correct guidance in place. And I know that other people have been pushing that. But I think also the support that we have on offer as well, and I think Leo mentioned this in the chat as well, is about how we can constructively as a movement move towards a more sort of virtual way of supporting each other. And that's why I think this today is so really important as part of that as well. But making sure they're accessible and making sure that people get that support, whether that's in the workplace or whether that's in their society, if they're shielded. I mean, people who have been shielding, who knows how long that's going to be for these people? Because until we've got a vaccine, there's no other way of keeping these people safe from this virus. So there's some real issues that the government are still not able to do that we're concentrating on at the moment to give people that hope that, yes, things are going to change. And I think that's the big thing, really. We're having to adjust to a big change. It's huge for us all as a society. So we've got to do everything we can as a society, as a movement, to reach out and to give people the best support that they can possibly get. And that's what we're doing as an opposition at the moment, is really pushing the government to drive home that message, to give the support where it's needed, which is our socialist values at the end of the day. And that's what we're trying to push forward on.
Thanks, Angela. I'm not sure everyone would agree. You guys are doing a great job at that. We've got lots of questions that fall into this bracket. I'm going to try and crystallise it with a question from Ivor, who says, I'm going to put this to you, Jamie, if I can, and then I've got a little follow-on afterwards for Steve, which is, I'm nearing the end of the 12-week in isolation. It's really weighing on my mind heavily going back to work. and sure other people are in the same situation, what support can we give those members? Because obviously, if you remember back to the start of this, the government put those people into isolation for 12 weeks. We got an agreement with our employers to make sure they're paid. That time is now ticking away. How can we support them, Jamie?
Yeah, well, as I mentioned before, Chris, stress risk assessments, that should be the first key. When people are returning in our area, we're identifying there's a need for stress risk assessments, because what stress risk assessments do is that they're really effective because they result in an action plan for the individual. And some individuals need more support than others. But if you go through the stress questionnaire, it's a guided conversation, you get you identify what the need is for that person, and then you create an action plan to support that person. So if that was in my area, we'd be going down the stress risk assessment route.
Thank you. We follow on, Steve, to you. I mean, the flip side of that is people at home for 12 weeks in isolation. We've had a couple of questions on that, who are lonely, perhaps on their own. How can we support those individuals through this period?
Well, as I said earlier, we can't go and see them physically unless we stand outside their windows and talk to them that way, which we've done for a number of people through our service, but actually by regular contact. That's why we set up the free phone service so people could phone in. We phone them back. We set times to phone them so that they've got some kind of contact. But the really important thing about that phone call is not assuming that we can do anything to help, but asking those people what would be helpful. And this is also on the back of the stress risk assessment in workplaces, is that as well as doing the stress risk assessment, we should be asking an open question around, what do you think would be helpful for you? What would make a difference for you? Because it's really important to give people a sense of control in these situations where they actually believe that they have choices, and they're not just being, in this case, being forced back to work. Because that takes away control, and that is bad for mental health, full stop. But what we're seeing is not an interest in people at the present time from this government. It's an interest in getting an economy restarted so that the costs that we're incurring as a nation and as a globe are not imposed upon the bosses or anything like that. They're imposed upon the individual. They're imposed upon the population. And that's a cheap way of getting out of responsibility, in my view. And this rush to return is an economic one, not an emotional or a psychological one. It is simply to make sure that the costs are forced down as far as possible. So what we should be doing is finding out how we can, by literally asking those questions, how can we help you? How are you coping already? And these are really important questions. Somebody who's been in lockdown for 12 weeks, they've coped with a very difficult situation. People who've been on their own have coped with a very difficult situation. We need to get them to notice their own autonomy, their own abilities, their own qualities in these situations, and build upon those, rather than assuming that they're having a terrible time and that we need to empathize with it. We need to pull out their strengths.
Thank you, Steve. Just to update you all before I put the next question, we've had 1,000 views on our Facebook stream as well, so lots of people joining us as well as being here on Zoom, which is fantastic. A question for all of you. I'm going to put this one to Shelley first and then go to the whole panel. Joseph said, are there any positives from the changes we've had to quickly introduce in terms of harnessing some of this chaos to take forward into future ways of working, specifically with communications, working from home, less commuting, pollution? I mean, the CWU has been at the forefront for the last 2 years, calling for a new deal for workers in the country. We hear calls for a Green New Deal. We've seen in New Zealand today calls for a 4-day week. Is this an opportunity, Shelley, starting with yourself, for the union movement to start to shape a new type of future?
It's a really interesting question, and I think it's really important that the CWU has picked up on this about, no going back. We need to make sure that the future looks better than the past as we come out of this crisis. Whoever asked the question mentioned working from home, and I'm going to pick up on that specifically because I think that is one working practice that, for those where it's possible at least, can be really beneficial for people's mental health. It cuts down journeying time, and it means you can spend more time potentially with your family. And it also means, and I think this is a key thing about why bosses like us to be in the workplace rather than working from home, is that they like to have us where they can see us. It's about surveillance and it's about that power relationship. So I think where people have demonstrated that they can work from home, I think that's one thing that we need to hang on to and try and negotiate. The government's made noises in the last couple of weeks about potentially offering that out as a right. We need to make sure that's actually meaningful and not just kind of words that don't mean anything.
Thank you, Shelley. Angela, I mean, at the last election, the party talked about transforming the world of work. Is that still where you're at?
Yeah, and we're transforming the way we campaign as well. And I think how we change society and how we make it more accessible has changed. It was funny because the second week of lockdown, I got a call from Charlie, my son, who's blind. I got a call from his teacher, you know, because he's in that vulnerable category, asking how he is and, you know, a bit concerned and stuff. And I said he's living his best life, because everybody now is having to use accessible digital tools in a way that my 11-year-old was left behind, because everyone was running around and you couldn't catch them. Whereas now everyone's online and doing things in a way that he, you know, his mates are where he wants them. And he's found his world has changed for him in a really positive way. And he's got mum and dad more than he's ever had, and he's in his safe cocooned environment. So I think there has been some positives for people and there are opportunities, but like I say, it's a fundamental big change, and that with change comes challenge. And if we're able to support everyone going forward and put the resources into making that happen, I think that there is some positives that we can take from this. But if you look at the unemployment figures this week, Chris, I mean, they're unprecedented, mate. The amount of young people, I mean, there's people now that are being made unemployed that probably won't go back into the workforce. The closing of the mines in some of our northern seats and Midlands, it's going to be, what's happening now is going to have a bigger impact and a bigger scar than what happened in terms of the mine closures and the change in the industrial industries of the past. So we have to respond to that challenge with hope and aspiration, and therefore the stuff around climate change and the new digital jobs, I think there's some tremendous opportunities for us to look at how we support people into new industry and have a bold vision for our future, but only if the government's willing to grasp it. And we've got to do our utmost now to have a campaign and organisation now that is a real movement that shifts the government, so that we can have that bold and that positive future that we all want to see for our young people and for people going forward.
Thank you, Angela. Steve, I mean, is there anything you particularly picked up in terms of what you'd like to see as a change in people's habits after this crisis?
Oh, absolutely. I mean, first of all, I think this is a huge opportunity to change many sets of behaviours of all kinds. Interestingly enough, I completely agree with Shelley when she said that bosses like to have the people where they can see them. Ironically, well-run companies that are very democratic need far less managers because they don't have people having to take control all the time, because people are enthusiastic, want to work, want to do the job, want to get on with it. And there's a lot of evidence that suggests that people who are comfortable in their environment work better, faster. So I completely get the 4-day week down in the Antipodes. That makes perfect sense, and they've already trialed that. But there are also real issues around how we're going to begin to think about engaging people, not necessarily in work in the sense of producing something or delivering something or of that nature. We actually need to think about how we're going to engage people in meaningful activity. And there are very few studies that actually show that work is good for you. There are very few studies, there are probably only 20 or 30, but there are over 400 studies that look at recreation, that look at creativity, that look at those kind of activities that make sense. And if we've got a world that is going to go increasingly digital and increasingly automated, then we need to be thinking about how we're going to engage people in a meaningful activity in the world in order for them to have meaning in their lives, but also to begin to develop things for communities, for nations, and for the world itself. We need to be thinking about a much bigger, much longer term picture.
Thank you, Steve. Jamie, I'm going to let you be the General Secretary for the next couple of minutes. What should the CWU be fighting for?
I think on this, Chris, we've got to look at the good and the bad in this and learn the lessons from it. I think we've also got to work with other trade unions and identify what good has come out of coronavirus. And you know what? There has been a lot of good. I mean, there's been a lot of inspiring stories. You know, I mean, one thing I've noticed is in our area, there's a lot of people who don't understand as passionately as some of the safety reps the importance of social distancing, and that can then frustrate people who are really so passionate about it. You know, and some people get the need, and other people don't. I think for us though, as the CWU, we've got to learn lessons from it, and we've got to link in with other unions, especially key worker unions, because if we come together on it and identify good practice that has come out of these, then we'll be ready for the next time.
Thank you, guys. I'm going to come to Angela, then Shelley on this question. I'm going to put two together. Colin's saying it's his hope that trade unions can show people and employers a way forward in this time, and I think we definitely can. And Lawrence is saying that we need to pull people away from social media to adopt more recreational activities. One of the questions that I've had into me, someone's asked not to be named, sent in privately, is saying that she feels that social media plays a really negative role on mental health. So maybe come to you, Angela, who, I mean, I know I see some of the stuff, and we've seen some of the abuse that people like Diane Abbott within the party have got, which is absolutely despicable. But, you know, this must hugely impact on mental health. But at the same time, it gives people a voice. So, you know, what is the right balance, Angela?
Yeah, I wouldn't go on my social media for your mental well-being, if I'm honest. I don't even look at some of my... I post to give people information on my social media, but I don't look at it anymore because it's toxic. It's awful. And I had this problem when I was the Shadow Education Secretary, even when we wasn't on lockdown, because our young people use social media now as a means every day of communicating. In fact, a lot of them use it more than they do actually meeting the mates, as we used to do before we had... I think I was one of those that used to have to go to the phone box still when I was younger. So I think the world in which we live in has changed and will change again. So I do think that there's more that companies can do to make social media a better place. But I think some of the stuff that Colin was saying and some of the stuff that I think Steve was saying about how we use our recreational time. I mean, I must admit, I'm spending about 6 hours a day looking at a screen, you know, Zoom calling at the moment, or like today, it's been beautiful, the weather, and I've been sat in this office all day, literally on my own, just talking to a computer screen, and that can't be good for people. So we're going to have to, and I think the movement has a role to play in how we keep people mentally well during this process as well, and that means creating and not having to apologise for us having a more of a work-life balance, where people are encouraged to take more recreational time, and how that will help their well-being of the whole of society. So I think some of the stuff that before we felt that our demands were not being met as a movement, I think actually we should grasp that nettle and start to talk about preventing people from getting unwell in the first place, and making sure that mental health is put a parity steam with physical health. And you certainly wouldn't allow an industrial injury where you're constantly putting somebody in a situation we know is harmful for them physically, but actually we do that all the time with mental health and mental well-being. And I think we've got a real opportunity now to push forward on some of those issues as well.
Thank you, Angela. Shelley, I'm thinking about obviously yourself using social media regularly, individually, and the work you do as well. Like, you know, you must have seen some of the abuse that goes around. What's the balance for you? I mean, obviously, sometimes, you know, it just does step over the line, doesn't it?
Yeah, absolutely. In solidarity to Angela and to all the other women in the public eye who receive the most vile, sexist and racist abuse every single day, it's completely unacceptable. And when it comes to social media, I feel like this is an issue that's kind of fallen off the agenda in the last couple of years. We obviously need to make sure that there's that balance, don't we, of civil liberties. And I saw somebody talking about civil liberties in the chat box earlier. As well as the kind of the balance of regulation against hate speech. And while social media can be, you know, it can be really positive, can be really useful in terms of making things more accessible, and particularly, you know, in the current crisis, it can be really useful as well in how we organise as a movement. But absolutely nothing replaces that kind of face-to-face organising or going on the streets to protest or strike. And we have to make sure that we don't forget that once this crisis is over, that we get back to our physical organising as well.
Thank you, Shelley. There's been a couple of questions as well about the potential for the union to be delivering welfare calls to representatives just during this period. Or one thing to fill you all in on, I think it's a fantastic initiative, is that the union's leadership has partnered with Mind, the mental health charity, and we're going to launch our own mental health phone line for CWU reps in June. So led by Dave and Tony and the NEC, they're going to be putting that out, I think, in the next couple of weeks or so, with an exact confirmed date where all of our reps will have access to mental health support via a free phone line. So I think that's a great thing. So well done to the union there. It's a big one. So coming to some of the questions then that we were sent in advance, because I've cut across all of them, and so I'm sorry to those who have taken the time to come to us early. So Steve, given the anxiety caused by COVID-19, potentially massive job losses and significant changes to the way we're all working, sometimes at home in isolation, are we facing a mental health epidemic? And if so, what can be done?
I wish I knew the answer to that question.
That's a very good question that Emma's given me there, isn't it? And you've got 30 seconds to answer it. No, I'm just kidding.
Oh, thanks. There is a huge job here. I think the idea of kind of calling it a mental health epidemic, I think really is over-egging the pudding. And the problem is that the press actually build these stories up and create them, and then we finish up with some kind of belief. I mean, I actually tweeted about this the other day, that it's almost a self-fulfilling prophecy, that you know, and it can be created. And this has happened in many disasters in the past, where the press has over-egged the pudding considerably. I mean, the Storm Karina in, I never remember the name of the city. I don't know, there's something wrong with that. But there they reported rapes, they reported murders, they reported gunshots, and none of it was true when it came out. But people then assumed that the city was in chaos, whereas in actual fact, people were supporting each other incredibly well. And there was very little sign of mental health difficulties. Those came later when people were abandoned and they weren't looked after and they weren't supported in any real way. I think that we need to be very careful about using these kind of terms, these pejorative terms, because people are reacting in a normal way to a completely unexpected situation. And what we need to do is to make sure they're educated, that they understand what's going on, they get truth, they get honesty, but above all, they get real proper education about what it is that's going to make them safe. And to just give you an example, there's a lot of confused messaging about masks at the moment. And I'm seeing people wearing masks when they're in cars on their own with the windows shut. That's completely pointless, okay? Because the car is a far better mask than the mask ever will be. But I'm seeing people that have worn masks so many times that they're dirty, they're actually going grey. So if they have got the virus, they're spitting it everywhere anyway. They've been missing filters off their masks. They're wearing masks in open spaces when they're not within 20 meters of anybody else. When they take them off, I actually saw somebody scrubbing his nose the other day through his mask. And basically, if he had the virus, the next thing he did was went and touched the surface. Then he's transferred the virus. There is so little education around the practical stuff. Yes, they talked about hand washing. It probably still is the most important thing we can do, but it's almost been taken off the agenda, and tracking and tracing and testing, tracking and tracing have become most important. But the testing is absolutely pointless without the tracking and tracing, because you can test somebody one day, they can have the virus the next day, and if they haven't checked out who they've been in contact with, then the whole process starts all over again. You need to do another test. So everything is just plain chaotic at the moment, and they're not thinking through. They're just throwing stuff out there in the hope that it'll reassure people, rather than actually making it clear what the real issues are. And that's something that's bugged the hell out of me all the way through this whole process, is the dishonesty and the manipulation that has gone on as though everything is hunky-dory.
Thank you, Steve. I'm going to put one more question now to Angela, and then I'm going to give the panellists a minute or so to wind up before I hand over to our North West Regional Secretary, Carl, because I forgot to do that at the beginning. It wasn't on purpose, honestly, Carl. You probably don't believe me now. So the next question, Angela, is obviously, you talked a little bit about the crisis that we're facing in one of your earlier contributions, but one of the things that people are asking in the chats that came through in advance of this session is, are the Labour Party going to reverse the cuts to mental health provisions that the Tory government have enforced?
If I've got anything to do with it, yes, we will. I mean, it's minimum. I mean, we cannot go on business as usual. If there is anything that's shown us that, it's this the failure to prepare for the pandemic. We knew it was coming. We knew it. The government knew. They'd done their own simulations in 2016. They had their own report that told them what needed to happen. We were too slow going into lockdown, and there's so many things that we under-resourced our public services. I mean, just look at what the Royal Mail did and the attacks on Royal Mail workers, whereas some people, the only person they'll see is their postie that day or that week. And I just think we have to reset the balance on everything. And that the positive for me in that is that there is suddenly an opportunity for us to start putting the care back into society, that socialist principles that we have. Everything's been driven since the Thatcher era, I think, from market forces and us doing the best. We're all on this like treadmill. And you've got to get the best job. You've got to, you've got to have the biggest house. You've got to buy your own house. You've got to have the best job. You've got to have the best title. You've got to have the best car. And actually, I think this will reset people to thinking, what are my values and what do I want from a better society? So I hope, and I will make sure that the Labour Party is part of that conversation with our wider trade union movement on what type of society we want to live in and how we go to that. The economy, people talk about the debt and the deficit. I mean, the economy, the world economy is going to have to reset as a result of this, and therefore the monetary situation that people talked about before. I mean, the tests on the deficit, the deficit now is just, we don't even know what the government revenue will be at the end of this process. So this is an opportunity to talk about our economy and our society in terms of our values, and I want to see us reset that. We're going to make John McDonnell and Jeremy Corbyn look like Tories by the time we finish with what needs to happen. And to be honest, Boris Johnson has found that little red book, because the stuff he's doing, and then, they were talking about Wi-Fi, nationalising Wi-Fi is a bit of some dirty word, which I know the CWU helped us with that policy, and now all of a sudden everyone's saying what a good idea it is to have free Wi-Fi for everyone. So I think the parameters have changed and we need to seize that opportunity.
There you go. Broadband communism was right after all. So we're going to give each of our panelism 30 seconds or so to sum up, starting with yourself, Jamie.
Yeah, for me, really, Chris, I think going forward, I think we've got to try and get those people who are naturally covered under the Equality Act. I think we've got to get to as many of those people as possible. I think we haven't touched on tonight, but disability risk assessments are really key for us in terms of introducing reasonable adjustments. In our area, we've got going on this over the last few years, and we often see employees doing physical disability risk assessments, but we rarely ever see them doing mental health disability risk assessments. And, in the last 3 years, we've done over 50 disability risk assessments in our area for long-term mental health conditions. And that's significant, because little minor changes the most subtle changes make a massive difference to people. So we've got to get in these workplaces, getting these disability risk assessments done. I think we've also proven to businesses that there's a mutual benefit there, because when you introduce an adjustment for someone, it normally means that person is more likely to stay in work. So there's a benefit for the business as well. And from my experience, doing disability risk assessment for mental health, they don't cost very much, the reasonable adjustments, and a lot of them are cost-free. I think we've also got to share best practice with trade unions. There was a fantastic event in Liverpool in January where the TUC in the Northwest set up an event where we were able to share best practice with other unions. And, we've been sharing risk assessments examples on OCD with other trade unions now, and they're sharing stuff with us. So we've got to share best practice and we've got to move forward together. I think just from my own perspective, I think just getting back to the theme of Mental Health Week, remembering that the theme this week was about kindness. So if everyone on this call tomorrow could just have one act of kindness where they go and check in on someone and ask them how they're doing, that could have a massive effect, because one single conversation can change someone's life. So maybe that's a thought for people on the call.
Thanks, Jamie, and thanks for all the work you do on behalf of the union, mate. Fantastic job. Steve, I'm going to ask you to just give us 30 seconds or so summing up. You're muted, buddy.
Thank you. That's the third time I've done that today. First of all, I think that we need to recognise that mental health, mental well-being has it runs the gamut from people who really need medical intervention to people who need social intervention. And let's not forget that there are people who need some kind of medical intervention. I'm not getting away from that. I'm not denying it. It has to be a nuanced approach. It has to be a thoughtful approach. But the key issues for me always are education, 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 to coin a phrase. And it is about people understanding more about their mental health, but not in a medical way, I don't want to see a disordered population, which is what I'm very concerned could happen in this situation, that we all become diagnosed with depression or anxiety or something like that, when it's a normal, natural response to a difficult situation. I think the other thing we need to recognize is, as I said earlier, each person has a value of one, and that includes BME, LGBTQ. Everybody has value. Everybody is worth that one. And we need to remember that. And from my point of view, we need to be thinking about the far distant future, not even 5 years' time, but 10 years, 15 years' time. What kind of a world do we want? What will it look like? What will we be doing? What kind of a society, what kind of a globe will we have? Because what we have now isn't working, isn't sustainable, and is going to be a disaster in its own right.
Thank you, Steve. Over to you, Shelley, if I may.
Yeah, just to say, I think this event has been brilliant. It's amazing to see so many people attending it, but also the level of engagement in the chat and everything. So well done to the organisers. I think too often that the talk about mental health is geared towards what individuals should be doing to kind of deal with stress or build resilience to it. So it's really refreshing that this conversation tonight has actually been about our collective response as trade unionists, and that it's been less about awareness and more about taking action. And we know that action doesn't come unless we organise, and that's the role of our reps, to ensure those people with mental health problems are given the support and any reasonable adjustments that they need in the workplace, and to push back on the things that we know cause work-related stress: unmanageable workloads, insecurity, low pay, and bullying bosses. And let's not forget as well that coronavirus itself is a stressor. People will be anxious about their own health at the moment, about other people's health, their friends and family. And lots of people will also be experiencing bereavement. These are the kind of things that our union health and safety reps can step in and help with, but they also need support themselves, as others have said. And as a wider movement, I think we also need to be thinking about not just what's happening in the workplace, but the bigger political context. Mental health services available on the NHS are not enough. We need much more funding, but we're also likely facing a big fight ahead of us with a second round of austerity as the government moves to pay for the coronavirus crisis with more cuts, in particular to public services. So if we're serious about protecting mental health, protecting jobs and pay and the future of our industries, we need to be ready to resist that industrially and politically. That means linking up with anti-austerity campaigns in our communities, and it means taking to the streets when it's safe to do so.
Thank you, Shelley. Brilliant. And final from our panellists will be Angela, before I hand over to Carl. Angela?
Yeah, thank you. I won't speak for long because I think I've taken up a lot of time already. I just want to say thank you. I thought a lot of people know my background, and I came from a, shall we say, dysfunctional background. And my mum, I said one of my memories was lying on my mum's bed when I was about the age of 10, not wanting to go to sleep because I thought my mum was going to try and kill herself that night. And I remember raising my mum from an early age. So the only family I've ever had is the trade union and labour movement, and it loves us for whatever we are and whoever we are. And that is the best thing about our movement, actually. It accepts us for who we are. And they're the values that I've taken from the years that I've been in our labour and trade union movement. I was born in Stockport but raised in the trade union movement. And I just want to say to everybody on this call, thank you so much for giving me a home and for looking after us. And I think we'll continue to do that into the future. And I want to continue to play my role in giving back to the society and to the movement that gave me so much. So thank you.
Thanks, Angela. And I think on the day you were elected as deputy leader of the party, I think our General Secretary Dave tweeted that you've always had our back and we'll always have yours, and that will certainly always be the case, I think. So thanks for your contribution tonight, and always. Over to Carl Webb to say a few words, and then I'll close the session up. Carl?
Thanks, Chris. I want to be dead quick. I want to thank, first of all, thank you, Chris, for agreeing to chair this for us and facilitate it. You've done a fantastic job, as always, for us. So thank you for that. I want to thank all the speakers, the panellists. I think I've had messages from people who've been on this call saying, well done, North West, this is amazing, one of the best ones I've been on. And I know you're all busy, but I know Angela's especially busy appointing a new General Secretary for the Labour Party and probably been on a lot of Zoom calls. But I really do appreciate it. I agree with you, Chris. Angela's a really good friend. I knew her when she was a CWU, Unison rep, sorry. So we'd like to thank her. We have got a North West Mental Health Network. That was set up by Mark Holt, Jamie and Emma Garno, who also organised this event. We all supported Emma, but she did all the hard work. She did all the chasing. She was hassling us, making sure we were getting everything set up. She's a credit to the North West region, Emma. She's our finance officer, which is a lot more than that. And she's worked extremely hard, and I'm so pleased for her that it's been a great success. We've looked at all the comments that have been on there. We'll take them away as a region. I know Chris will take some away nationally as well. And the Mental Health Network, we'll have a look at that. We'll look at it regionally, and we'll see if we can implement some of the ideas that have been put on the chat. So I just want to, again, thank you all for coming on the call. I hope you found it worthwhile. We're going to do more events like this. As this week's been going, by the way, we've been putting out videos. We've got some sway documents. We've been putting out information. But again, you know, it's a group effort, I can assure you. So thank you to everybody. And over to you, Chris.
Okay, thank you, Carl. That's fantastic, mate. So just for me then, the panellists have all been fantastic. So thank you to all those in support of what Carl's just said. I also want to thank Rosie, our signer. So these sessions gone on for like over an hour now. Rosie's done a fantastic job. So well done to you, Rosie. The one final thing I want to ask after you all before we close the session is we want to do a little video with, obviously we have Clap for Carers and Key Workers every Thursday. We want to put that out tomorrow. So I'm just going to unmute you all. So if you're swearing in the background and doing any sort of mad stuff, please stop that now. And just join us in 30 seconds or so applause that we can put out tomorrow from the union, if that's okay. So just a quick clap for carers from everyone, 30 seconds while we close the meeting.
Few women actually. I look through them a lot. Yeah. You look at the list.
Okay, good night, everyone.
Rosie.